Urinary tract infections, UTIs, are one of the most common infections worldwide, affecting millions of people across all age groups. I'm Dr. Motahare, and in today's video, I'll walk you through all things that you need to know about UTI: symptoms, diagnosis, sample collection, treatments, and also complications, all based on the latest global medical guidelines. Let's get started. So, what is UTI? UTI is a kind of infection that occur in any part of urinary tract, from kidneys, ureters, bladder, and urethra. Most infections are localized in the lower urinary tract. It means bladder, which is known as cystitis, and ureter. Infections involving the kidneys are more serious and are called pyelonephritis and can lead to severe complications like sepsis. The most common pathogen is Escherichia coli, E. coli, accounting for more than 80% of all community-acquired cases. Let's talk about the prevalence of UTI. Over 50% of women will have at least one episode of UTI in their lifetime. That is because of their shorter urethra, sexual activity, diaphragm use, and postmenopausal estrogen deficiency. In men less than 50 years old, UTIs are less common. But after that, because of prostate enlargement and the obstruction that is caused, UTI prevalence is higher. Some men need to do catheterization for that obstruction. That also increases the risk of UTI. In children, during infancy, UTI is the most serious bacterial infection and should be considered for any infant with fever, with not feeding well, too much crying, not seeming well infants. In elderlies, there's very high rate of bacteriuria. It means that there is bacteria in their urine, but most of them are asymptomatic. This is like anything else in the elderly. In elderly, we don't have lots of symptoms. Even serious infections, serious problems are silent, most of the time silent. That's the reason everything in this age is very dangerous. We should take care of them. Maybe there is no symptoms, but suddenly they will collapse. And in pregnancy increases the risk of both UTI and pyelonephritis, both because of hormonal changes and also anatomical changes. About the symptoms, we just categorize the UTI as lower UTI and upper UTI. Your lower UTI or cystitis, the symptoms are burning during urination, dysuria, increased frequency and urgency. You need to go to the bathroom very gently. You cannot wait. Sometimes suprapubic discomfort, that kind of pain in the lower part of your abdomen, cloudy or fuel smelling urine, sometimes hematuria, that means blood in the urine. But when we have upper UTI, pyelonephritis, things are different. We have fever, high-grade fever, flank pain, pain in costovertebral angle in your back, and also tenderness. When you just do this, you will feel pain in that areas. There's nausea, there's vomiting, and also there is chills. The pyelonephritis is a systemic inflammation. So there are all symptoms of a systemic inflammation, like malaria. In children, symptoms of UTI are non-specific.
because they cannot tell you that they have dysuria, and they don't know what is pregnancy because they urinate whenever that they want. So non-specific symptoms like fever, vomiting, irritability, like that infant, poor feeding, also all should guide us through thinking about UTI. Maybe this is UTI, maybe this is not. But children, young children cannot tell you about their symptoms. We should think about things based on the symptoms. And in elderly, again, maybe there is no obvious symptoms, but they may feel confused, they may fall, okay, or they may have functional decline. All of these things may be a sign of an infection, a problem, that one of them can be a urinary tract infection. We should take care in those age group, one in elderly and the other one in very young children, infant and toddlers, and even 3 to 4 year old babies. About routes of infection. Ascending infection is the most common route. Bacteria from the perineal skin or rectum enter the ureter and ascend to the bladder. There are other types too, like hematogenous spirit or lymphatic spirit, that are very rare and we are not to talk about them. So now, based on the symptoms, we decide for a urinary analysis test. We should collect the sample properly, otherwise the diagnosis will be a problem. In adults, we need a clean catch midstream urine. What is this? It means that first you should clean the area. After that, start urination, discard few seconds of your urine, then collect midstream in a sterile container that you got from the lab. In children, if they can follow these steps, that's okay. Otherwise, if they are too young, we can use catheterization or suprapubic aspiration. Bag collection for infants are okay for urine analysis, but they are not okay for culture because they are mostly contaminated with the feces, and the culture is not reliable. Specimen transport is also very important. If you cannot take your specimen very soon to the lab, you should keep it in the refrigerator. If you need more than 30 minutes to 60 minutes to transport your specimen. So when we have symptoms and we are thinking about UTI, we order a urine analysis test and a urine culture. Urine culture will tell us about the type of bacteria and also the types of antibiotics that will work for this special bacteria in this person. Urine culture is the gold standard for treatment of UTI. But in some situation, for example, in a woman which is not complicated, everything is normal, nothing special, we can start an empirical antibiotic therapy with the simplest form of antibiotics. But if this is not the case, we will order urine analysis and urine culture, and based on the result, we should prescribe the antibiotics. Never we should prescribe antibiotics just blindly without any confirmed diagnosis, because it can lead to antibiotic resistance. When and how to treat? In symptomatic patients, we should treat the patient based on the urine culture results with appropriate antibiotics for that patient. Sometimes we will do empiric therapy. That means that without urine culture, but in the cases of uncomplicated UTI in a woman. In this case, we should consider the local resistance patterns on that area. It means that The usual bacteria in that area that woman is living are sensitive to which antibiotics. But most of the time we should rely on urine culture results. Duration of therapy for non-complicated cases are 3 to 7 days, but sometimes is longer for complicated ones, or when the patient is a man, or there is some special situations. We have a condition which is called asymptomatic bacteriuria. It means that there is bacteria in the urine, but the patient doesn't have any symptoms. In this situation, treatment is not needed unless the patient is pregnant to decrease the risk of pyelonephritis and preterm birth, or the patient is going to have some kind of urological procedure which can have mucosal bleeding. Just in these two cases, we should treat asymptomatic bacteriuria. Otherwise, we should not. Over-treatment promote antibacterial resistance and adverse drug effects. What are the complications of UTI? The first one is pyelonephritis. It means that the bacteria just goes up until they reach the kidney and infect the kidney. This is very important. That can lead to urosepsis. Sepsis is a kind of severe infection in the blood. The other one is renal abscess formation. Children with recurrent UTI can have kidney scarring that leads to hypertension or chronic kidney disease in the future. If there is recurrent infection, we should look for the etiology, and also be careful about babies with UTI. Sometimes they need long time follow-ups in order to prevent further UTIs episode, in order to prevent scarring. It's very important, even before 1 year old or after 1 year old. When we have one episode of UTI, consult completely with your doctor about the follow-up. It's very important to prevent scarring, kidney scarring, and lifetime problem for the baby. So for prevention, stay hydrated. Drink at least 6 to 8 glasses of water daily. Do not hold your urine. Empty bladder every 3 to 4 hours. Wipe from front to back. Prevent bacteria from entering the urethra. And also teach this simple habit to your children. Teach them to prevent from future UTI. Avoid irritating feminine products, douches, powders. Surely urinate after sex. It helps you flush out bacteria. And also before sex, clean yourself completely, and your partner, both of you. Wear cotton underwears. Avoid tight synthetic underwears. Okay? And there are some kind of natural things that there are not too much evidence for them, but some literatures tell that they may work, like cranberry products or probiotics. This is very important. Probiotics, lactobacillus. I have some videos about probiotics too in this channel. And also consult with your doctor if you have recurrent UTI, or you have a postmenopausal woman and you need to get some more support in different forms to prevent recurrent UTI. UTIs are treatable, but knowing when to treat and when not to is very important. And also prevention is so easy. You can prevent it even for our children. Whether you are a parent, patient, or medical student, I hope this video gave you some practical tools for smarter evidence-based decision. If you found this helpful, please like this video, share it with someone, and don't forget to subscribe. I'm Dr. Motahare. See you in next episode in the Art of Medicine. Bye.